afternoon. Today I want to start by asking you a question. How many of you have a female family member or a female friend? That's right. Most of us do, right? Well, let me tell you something about a situation that multiple women around the world are facing right now. Many of us have seen the pink ribbon that honors survivors, remembers those lost to the disease, and support advances made to cure breast cancer. Despite all advertisements and the quick lesson titled Breast Cancer, according to the American Cancer Society, in 2021, an estimate of 281,550 new cases of invasive breast cancer and approximately 49,290 new cases of non-invasive breast cancer will be diagnosed in the United States. Now, in the United States, breast cancer is the most common cancer in women other than skin cancer, and the second leading cause of death after lung cancer. These numbers can change if every person understands the importance of early detection and how this can save lives. Knowing the symptoms, risk, and prevention methods of breast cancer screening will help a loved one to avoid late detection and devastating results in the future. Let's talk about symptoms. The most common symptoms is a new lump in the breast area, swelling of all the part of the breast, skin irritation, breast or nipple pain, nipple retraction, redness, a thickening of the nipple or breast skin, discharge. Now that we know the symptoms of breast cancer and what we can look if you are a woman, of course, but this is not a job only for the ladies. This is a red flag for everybody around us. And yes, I know, ladies, it's hard, it's difficult to talk about a private part of our body, but this is the first step to make a wise decision. Let's talk about the risk. The following risk factors may increase the chance to develop breast cancer, but does not determine that all women will develop breast cancer. Dense breasts. This makes lumps harder to detect. Aging. The risk increases with age, but can happen to women 40 and younger. Personal health history. Breast disease. Family history. First-degree relatives and family having breast cancer. Sister, mom, father, brother. Menstrual history. Early menstruation. Reproductive history. Use of birth control pills. Lack of physical activity. Excess weight can elevate the levels of estrogen. Obesity is an increased risk for breast cancer. Alcohol alters the level of estrogen. As we go thinking about the risk and exploring our own situation, it is important to remember that these risks are not always a determinant of who will develop this disease. Lastly, let's talk about the prevention methods. There is 3 modalities most commonly used for detection of breast cancer. One is mammography, second is ultrasound, and the third is an MRI. It is recommended that regular screening be conducted on women 40 and plus, or on women that have family history of breast cancer. Also, a self-exam is valuable tool to detect a physical changes in pain in the breast area and will alert if the need for extra screening. Today, my goal is to insist in the fact that we all can be a part of preventing that a loved one or somebody close to us suffers the consequences of this terrible disease. Early detection and screening can make a difference between life and death. Let us make these numbers small. Let us help somebody that may not have the resources to access the information necessary to prevent a devastating diagnosis. We can all help save a life. Thank you.